Time now for some important medical information. We don't tend to think about our circulation very much until we're having problems. Whether it's painful and unsightly varicose veins or a wound that just won't heal, there are solutions that don't involve major surgery. Let's find out more now from Dr. Tiff Siragusa of the Siragusa Vein and Laser Center. Dr. Siragusa, nice to have you with us today.
Thanks for having me back.
Okay, so first let's think about summer coming. A lot of people are worried about those varicose veins, spider veins, and things like that don't look good, but also they're very uncomfortable.
Yeah, this time of year we see several patients for spider veins and varicose veins because they're getting their shorts out of the closet again.
Yeah.
Heading to the beach, and they want their legs to be presentable. So we got to get a pretty big rush this time of year, early spring, for making legs look better, but also feel better, as varicose veins cause swelling, pain, and discomfort as well.
And that used to be a major surgery, but what do you do now?
Traditionally, this was a major surgery. These days, luckily, the procedures we use are injections and laser procedures that take about 10 to 15 minutes, are done in the office, and the patients get up and go about their day like they normally would.
So it's really minimal downtime then?
Minimal to no downtime, yeah.
That's nice. And that corrects the problem for good?
This is a genetic problem, so we carefully watch our patients on a regular schedule. The disease can recur, but usually the problems that you get rid of and address don't come back. You might develop new ones in the future, though.
Sure.
Yeah.
That's good news. One thing I think a lot of folks don't think about are wounds that don't heal being related to circulation issues.
Right. Varicose veins can sometimes be the tip of the iceberg to a deeper circulation problem. Arterial and venous circulation problems can cause leg wounds, which are a major cause for morbidity and loss of work and just misery in people's lives.
You have a patient that you wanted to tell us about who had a problem with a toe that was going to require major surgery, according to one doctor.
Right. She thought she had stubbed her toe, which caused a wound on the tip of it, but in fact she had very poor circulation due to pretty much a lifetime of smoking. And she was told that it would require major surgery to get things better for her. We saw her as a second opinion, and we were able to do a 30-minute procedure in which we put a stent into her blocked off artery, reestablished blood flow to her foot, and within 3 weeks her wound was about 70% healed.
And the picture that we showed is not nearly as dramatic as some of the pictures that you sent to us. We were trying to spare you some of the more graphic pictures.
Sure.
But it was a really significant wound that you made a dramatic difference in.
Yeah, she had been dealing with this getting worse for 6 months, and then over a course of 2 to 3 weeks, it was almost completely healed after fixing her circulation.
Wow, I mean, that is a dramatic change.
Yeah, these type of wounds due to poor circulation in the arteries typically occur on the foot, either on the toe or on the side of the foot where there's pressure, as opposed to ulcers and wounds that you can get from vein disease, which occur on the ankle or just above the ankle, and are usually associated with leg swelling and discoloration above the ankle as well.
So if you have something like that that's not healing, talking to a vascular surgeon sounds like it would be the best idea.
That's typically the best move to get the proper diagnosis and proper assessment. Also, with these wounds, the circulation is not the only important component. To get the most effective wound healing, you really want a team approach. And once we evaluate a patient with a non-healing wound, we assess and correct their circulation, but we also make sure they have appropriate wound care and also appropriate infection control, because those are two other important components as well.
Really interesting. Thank you so much for being with us today.
Sure.
All right, if you'd like more information, you can visit the NashvilleVeinCenter.com.